Hello, this is Med Lab Diagnostics. We are addressing a question we got from a customer on how to determine the difference between a BV, bacterial vaginosis infection, and a yeast infection using our vaginal pH test strips. And the way we do that is we use a combination of the symptoms that you are having with the vaginal pH value that you get by using our strips. And so what you want to do is when you get the test strips, you're going to receive the bottle of strips, the instructions for use, but also in the packaging you're going to get a vaginal disease symptom chart that looks like this. The chart in the packaging is going to be smaller. I've printed this out in large form to make it easier for the video, but you're going to get a chart that looks like this, and it's going to list some of the most common symptoms for the common vaginal diseases, for different common vaginal diseases. And bacterial vaginosis and yeast infection are the first two on there. So what you would do is you would kind of look at what your symptoms are and see which one of the two diseases matches up most closely with the symptoms that you are having. Is it a grayish discharge with a fishy odor, vaginal itching and redness? That would be for bacterial vaginosis. For a yeast infection, you're going to have a different kind of discharge. It's going to be white cottage cheese consistency, usually odorless. You're still going to have the vaginal itching. You may have burning and swelling in addition to that, and some pain during urination for the yeast infection. But the second thing that you want to look at is your pH value, your vaginal pH value, and this is what we're going to use the strips for. So when you go ahead and do your vaginal testing and you go ahead and take the swab of your vaginal secretions and put it on the strip, you're going to compare the value here to the color chart. And if you get a value that's in the 4.5 range here, this is the normal range. That value is most likely consistent with a yeast infection, as you can see in the chart here. So if you're having the symptoms that match up with a yeast infection, and then you get your vaginal pH result that's 4 or 4.5, then you know that it's most likely a yeast infection. If on the other hand, you have symptoms of bacterial vaginosis, or even just some vaginal itching and redness and not much else, and you're not sure what it is, if you go ahead and do your test, your vaginal test, and you get a result that is in the abnormal range, it's greater than 4.5, it's in the 6 range, then you know that it's probably not a yeast infection, and that it's probably something else, and likely it's bacterial vaginosis because that's the other most common of the vaginal diseases. But of course you want to go see a doctor to get it checked if you're having any kind of symptoms like that, just to get confirmation. But this kind of helps you be able to tell what the most likely infection is. So I hope this was helpful, and we'll see you in the next video.